Hi, my name is Tim Ria here at Digital Health Live CES 2015, sponsored by WebMD. Super excited to have Michael Blum with UCSF, and you got a really interesting title. How are you doing?
I'm great, Tim. Thanks for having me. So I'm the Associate Vice Chancellor for Informatics at UCSF, so I'm responsible for the digital health innovation and the more traditional aspects like the electronic health records at UCSF and how all this stuff touches our patients and changes all of their lives.
Yeah, I was super excited when Jill Gilbert had booked you for the show. We just had a pretty significant guest from Samsung here. Young Sun was here. So what were you brought out to speak about today?
Yeah. So we were talking about the partnership that UCSF has with Samsung, and we've developed the UCSF Samsung Digital Health Innovation Laboratory. And the purpose is really to put together the technology expertise of Samsung and the great depth that they have there with the clinical and scientific expertise of UCSF. There's tremendous excitement in the space of digital health right now, but we really need to bring in the clinical expertise for all the clinical workflows and the scientific expertise to validate all the new sensors and technologies to make sure that they really are meaningful for the patients, meaningful for the physicians who are caring for the patients, and that they can change behavior and that they do it in an accurate way. The last thing we need is a whole bunch of inaccurate data floating around now, just confusing everyone as we go through this very early period of digital health. So our role in all this is to validate the sensors, validate the algorithms, ensure that they measure what they think they're measuring, that the algorithms that are being developed really bring value to the patients, they bring value in wellness, and eventually that they really bring value to the healthcare system overall. So you need to be with an academic center with great clinical trials expertise, human subjects protection expertise, as well as having this incredibly rich, deep technology base that Samsung brings to it.
So can people partner with you guys, or how does that all work?
It's a great question also. So this is very much an open partnership. Samsung and UCSF are the founding, partners of it, but the platform that Samsung's developing is a very open platform. It's a reference ecosystem platform.
What did they call that?
So the SIM-band platform is the band that is foundation that has the sensors and it's got all the communication stacks on it and so on. So that's really a reference platform that third-party developers can build to so that they don't need to redevelop all of those basic technologies. And then UCSF brings the capabilities to do the validation of those technologies so that we're sure that they really, again, are accurate and reliable. So we encourage all innovators who've got either just great concepts or much further down the road and have technologies that they think work, that they want validated, to really be able to say, we've tested the thing and it really is reliable, to reach out and work with us at the collaboration.
Where do cloud analytics fit in with this picture?
Yeah, and so another great question. There's tremendous excitement around big data, the cloud data, and analytics. Samsung's also developing their SAMI.io platform, which is a large cloud database that'll aggregate a lot of this data. And it's going to be a fascinatingly interesting time when we've got streaming real-time data from millions of people going into the cloud. So we have much richer data sets than we've ever seen before, and we'll be able to start doing big data and more traditional analytics on it. There's probably a little bit of inflated expectations right now about what's going to come out of that, because doing those kinds of analytics really generates inferences and associations. We've got to take those, distill them down, and put the scientific and clinical minds to work to say, okay, which of these might be real, which might be meaningful, and then do more traditional studies to see if they really bring value, again, to the patients and to the system. I think we're going to go through a bit of a bumpy period where people are pulling a lot of analytics out of the cloud, out of these large databases, and generate a lot of excitement. And we've seen that over the last 50 years in healthcare and in healthcare clinical trials. You do something once, you do it on a pilot scale, it generates an interesting, exciting finding, but then when you do it at a larger scale and look more deeply, turns out it wasn't so true. So we're going to need to go through that period again with the big analytics in the cloud to figure out what is meaningful, what is truly persistent, and what really changes behavior, wellness, health, health, chronic disease management. Tremendous amount of learning. It's incredibly exciting because 5 years from now, certainly 10 years from now, things are dramatically different than they do now in healthcare.
So is there any last bits of information or things you want to cover?
Yeah, again, I want to encourage people to reach out to us. I think
How do they do that?
that's a great point. So reach out to us at the Center for Digital Health Innovation at UCSF, which is cdhi.ucsf.edu. Right on the form, you can read all about what we're doing at the Center for Digital Health Innovation. You can see our inaugural projects that we're incubating, as well as how to reach out to us. Tell us about what you're doing. Tell us what you want to do working with us, and what value we can create together. And we're really happy to work with anyone who's got a great idea.
Yeah, no, that's great. Just bringing that community into the fold and I guess creating a quality reference to make sure the whole digital health space keeps rolling is a smart thing.
I think that's absolutely right. It's an ecosystem. This is not going to be 1 or 10 or 100 good ideas. There are so many aspects of healthcare that need dramatic improvement. Digital health is going to be a very important tool in doing that. We're going to need to create the ecosystem with the right quality, with the right caliber of partners, and there are going to be many of them, and we're looking forward to it. It's going to be a great time.
You're good on camera. You should have your own show.
Thanks very much, Tim. I'll leave that to you.
All right, cool. So we're super excited to have you as our guest. Thanks again for your time.
Thank you very much.